Hi, I'm Dr. Beth Haase, Chair of the Climate Committee for the American Psychiatric Association, and I'm going to say a few words about working with your friends, family, and patients on their climate-related distress. No matter the emotion they bring in, whether it's anxiety, despair, guilt, grief, betrayal, or anger, patients will come in with a number of different feelings. And it's important that you've processed your feelings first so that you don't overreact or invalidate the experiences that they are having. This involves looking at your own contributions to the climate problem, acknowledging your own grief, any hopelessness that you may feel, a tendency to discount future climate risks, all the ways that you may be protecting yourself from distress about the climate problem. It can be helpful to make an opening for the patient to bring up this kind of thing by asking if they have any concerns about the world, and to begin to bring in nature as an important part of their relationships and see if they have a secure attachment to the natural world. As you work to help them, you can start with mindfulness techniques that most of us are familiar with: breathing, meditation, relaxation exercises, praying, dancing, those kinds of things. Grounding is particularly important, tracking body sensations and feeling the ways in which they are connected to the earth and the outside world. And time in nature can significantly facilitate this. You then want to move them into some form of meaning-focused coping. The goal is transformational resilience, helping them to turn their climate anxiety into some form of effective action. This is probably best achieved in community with others around something that they care about, working with groups such as the Good Grief Network, the Work That Reconnects, climate cafes, and other climate support groups, as well as environmental organizations and activist efforts. In talking with the patient, especially when the patient is overwhelmed, we find that it can be helpful to use nature metaphors, for example, to describe the change we are all going through as a snail moving from one shell to the next, or a snake shedding its skin, to use something that we call the metaphor of the baby, which means that you talk with the patient about how we're all approaching this like infants, new to a new world, but alert, capable, and ready to learn. There are other techniques that we can talk about. If you'd like to know more, please reach out to the Climate Psychiatry Alliance and the Climate Psychology Alliance, as well as the Climate Committee of the American Psychological Association and the Climate Caucus for more information. Thank you for listening.